Sciatica, piriformis, and disc injuries finally explained. Hi, I'm Dr. Matt Maggio. I am the founder of Peak Injury Solutions, where our mission is to make chronic injuries obsolete. In today's video, what I wanted to cover was some information regarding sciatica, piriformis syndrome, and disc injuries. There's so much conflicting advice and information out there, someone isn't able to fully figure out what's going on. So we wanted this to be a definitive guide for understanding sciatica and piriformis syndrome, how to properly assess someone's own injury, and some tests that someone can do from home to really dial in what the problem is, because so many people are dealing with this problem. It's almost like at a pandemic level. People are dealing with low back pain, sciatica pain, pain down the leg, and they don't get real answers for their problems. So this video is going to serve as a foundation to give some real answers. So one thing that we always pride ourselves on in our office is having an accurate and specific diagnosis for any injury. And this is what I call junk box diagnosis. You know, a lot of times people are getting these diagnoses to appease the insurance company, to just really dictate treatment going forward, but it doesn't really tell us where the problem is. True definition of sciatica is where pain goes anywhere from here down in through the leg. Piriformis syndrome usually means that there's pain deep in the muscles, in through the glute and in through the hip. But the problem is it doesn't tell us exactly what muscles are causing the problem, where the nerve is caught, or if it's coming from the back, if it's coming from the hip, if it's coming from somewhere else. So what we're going to accomplish in this video is explain each of these more in depth. First one, is it coming from the back? Disc injuries are becoming bigger problems every day. We spend a lot of time sitting at a desk, at a computer, and what it does is it puts a lot of wear and tear in the muscles and the joint in our low back. So what I drew here was a model of what a disc looks like. So on top here you have the two bones. In between you have the disc, and the disc is a really good shock absorber. It can handle force like this all day long, but over time with poor posture, lack of movement, stress, everything else that someone can think of, it actually puts more pressure in these muscles around there and causes some scar tissue. When that scar tissue forms, it makes the muscles weaker, it makes them less flexible, and puts more pressure down on the disc. Now the disc actually starts to slide and grind itself. When that happens, this is what we did. We cut the disc in half here. It has a little toothpaste in the middle, and it's surrounded by these rings. And what happens is there's some tearing that happens in through here, and this toothpaste starts to come out. Now, when that toothpaste comes out, that's when people get things like disc bulges, disc herniations, disc protrusions, and those are usually really excruciating. When these rip, someone will get excruciating pain, a lot of inflammation, and a lot of things there. And a lot of times they happen when people are just doing normal, mundane things, you know, picking up something off the floor, just twisting and turning, but over time that disc has got a lot worse. So what we're going to show first is a test that really helps to narrow in if this disc is causing the problems of sciatica down the leg. So we have our clinical assistant here, Dr. Cussy. What she's going to demonstrate is a test to really assess if there's some degeneration in the low back. So we're going to start by going down on all fours in what's called the cat-cow position. And you want to have a good stable base. Here and here, everything lined up, knees under the hip, wrist and elbow underneath the shoulder. And the first part of this test is just going to drop down and sink your belly down. And then one question that I always like to ask is, what do people feel? And a lot of times when there's a disc problem or degeneration in the back, when they drop that stomach down, it can actually create some pain in the back. Now the next step is to come up and curl up. And this should be a nice, easy transition. When there's a bad disc in there and a lot of degeneration, this test can create a lot of pain. It can even reproduce some of that sciatica pain down the leg, but a lot of times can give problems local in the low back. So that's a great test to see if sciatica is being caused by the disc in the low back. So we either ruled out degeneration in the back or have it on our list as well. But there's no rule that says an injury can't have two sources of a problem. So if that test was positive, the next thing we want to do is see if the nerve is getting stuck somewhere else down the leg. So there's two other areas where the sciatic nerve can get caught. So essentially, your sciatic nerve has to go a long way. It starts in the low back and makes its way all the way down to the bottom of the foot. Now, nerves are built with extra slack and glide to keep them protected and safe, about 15% of extra slack. But what happens over time with poor postures, degeneration in the back, and just overall local trauma to the hip or the hamstring, this nerve starts to slide and grind its way through. When that happens, it doesn't get enough blood and oxygen. This in turn causes this stuff to lay down. It's called scar tissue. It's like glue that gets inside the muscle and causes two very big problems. The first problem is it makes the muscles way less flexible, and the next problem is it causes weakness. So over time, this scar tissue develops through here, and it actually causes the nerve to get stuck. It's almost like someone's pinching deep in the hip or down through the hamstring. So there's two areas that the sciatic nerve can get caught. One deep in the hip and one down through the hamstring. So we're going to demonstrate some tests to try to decipher where that's coming from. So we got Dr. Cussey back again. What we're going to do now is we're going to do a test where you basically bend down and see if you can touch the ground. So she's going to demonstrate from the side here. Now this test is really important for overall lengthening of the muscles in the back, the hamstring, and the sciatic nerve. So a lot of people will want to cheat on this one, but what you want to do is keep your legs as straight as possible, and you're going to overlap your hands like you're diving into a swimming pool. You're going to bend down nice and slow, and the goal here is to be able to touch the ground. Good. Come back up for me. That's the first step there. You want to see if you can just get down and actually touch the ground. Now in this next one, you want to kind of dial in and think about what you're feeling. So on this test, you're going to let me know if you feel anything in the low back or if you feel tension down one side or the other. And come back up.
A little bit in the left hamstring.
Left hamstring. So on this test, what we're doing is we're looking at a couple things. We're seeing how the back can overall bend, and we're also seeing how the hamstrings can lengthen. Now, one thing that can really help to be a decider on if it's a disc injury or if it's coming from the sciatic nerve itself is actually as you bend down, you get a lot of pain in the back. And that back pain is actually coming from some degeneration. So now we have two really good functional tests to assess where sciatica and piriformis syndrome are coming from. We have the down on all fours test where you cat-cow, and we have the one where you bend forward. Now, we collect a lot of data when we do that. We think about where do we feel it. We think about if it's coming down the leg, where we feel that. We have one more test to really decide if it's coming from the hamstring and the hip itself. So Dr. Cussey is going to watch us from the side here. And what we're going to do on that test that you felt where there was more tension on one side than the other, if you're positive for that, is we're going to test both sides. So what we're going to do first is we're going to bend this knee and keep this one straight. And we're going to go down and just see if that's easier or harder. Then we're going to come back up, and then we're going to switch and test the other leg. And which one was easier?
This one?
Yes. So in the earlier test, what she was feeling some tension down that left side, which shows us more and more that that sciatica-like symptom is coming from somewhere in through the deep muscles in the hip or through the hamstring. And as we went in there, we actually slackened that nerve when we did that, and it allows that tension to be less and go down from there. So those are three really great tests to assess for sciatica, piriformis, and disc injuries. So one of our major goals here at Peak Injury Solutions is to put an end to the opioid epidemic and really help people become better educated so they can understand the injury, understand what to do, get a proper diagnosis, and avoid bigger problems down the road, such as pain pills, injections, and surgeries. Sciatica and piriformis are some of the most common diagnoses out there, but the problem is it doesn't give us a specific idea of what's going on. So this video will really help. So we made this video really for one reason, just to help educate and inform people. So if someone has a question, a comment, or a concern, drop a message right into the comments, send us a message, we're always here to help. And if you want to find out more information, call us with the number listed below. We're always here to help, and we appreciate you watching the video. Thanks.